Hey guys, it's Coach Candace, and I've got a Next Gen NCLEX practice scenario that I've generated just for you. All right, let's get started. All right, so we have an unfolding NGN case study, and this is Next Gen NCLEX. That's what the NGN stands for. And we're going to do some practice today with a particular condition, and a little clue to that condition is given to you here with a little Giphy that my son made. His name is Deuce, and he's about 12 years old, so just want to give him a credit there. All right, so let's get going. All right, so here's our first screen, our case study screen. And you'll notice here that we are looking at one of six, right? So if you're not familiar with the NGN format for these unfolding case scenarios, then you'll know that there are six screens, right? So we're going to progress our way through the six parts of the clinical judgment model that is basically setting up the six scenario or six screen scenario. That said, we're going to start here on screen one, which is usually where we recognize cues, right? If you know the RAP GTE formula, then you'll know that the R stands for recognize cues. So that's where we're going to start. All right, to do that, we'll need to look at the nurse's notes. I will read those aloud. And then from there, we'll go over and look at the instructions. So we always like to start by reading the opening title line there that describes what kind of nurse we are, what kind of client we're working with. The nurse in the outpatient laparoscopy clinic is caring for a 49-year-old female client. All right, so we're in a lab clinic, and our client's name is Christine Lynn. She's 49, and the procedure will be an outpatient laparoscopic cholecystectomy. All right, and the post-op status on this particular client in this moment is 8 hours post-anesthesia. All right, and the PMH or past medical history, none significant. All right, and the code status for Miss Lynn would be a full code. All right, this is some information that you're being given. All right, here in the nurse's notes, we see that the assessment findings are the last void, and you'll see that they aligned with what's on the right side of the screen there. The last void was pre-op at 9 a.m. All right. The patient also received 1,800 milliliters of IV fluids intra and post-op. The patient reports lower abdominal pressure and the quote bladder feels full, end quote. Unable to void despite warm water in an upright position. All right, ambulated once with assistance, abdomen distended, suprapubic fullness noted, pain 3 out of 10 at the surgical site. All right, those are all the assessment findings. Now, current orders. Now, on NCLEX, you might have the opportunity to toggle between the tabs here. Can't really do that efficiently in this example that I'm showing you, but on your NCLEX, you'll be able to check out the other tabs there. And that's where we probably see these other orders, perhaps. All right, but here we're going to have them all on the same page just so that you can see them while you're looking at the question that we're going to look at in a moment. All right, so current orders, PO fluids as tolerated, ambulate with assistance, acetaminophen hydrocodone, 325 milligrams PO, Q6 hours, PRN. Void before discharge, and discharge criteria checklist in progress. Okay, so those are the nurse's notes and some current orders. Now we're going to move on to taking a look at that second tab, vital signs. All right, we're still on the first case study screen of 6, but we're just checking out the tab, the second tab there, vital signs. All right, so the temperature is 98.4 degrees Fahrenheit. The heart rate, 88 beats per minute, because we're looking at vital signs here. All right, blood pressure, 124 over 78. Respiratory rate, 16. And the SpO2 or pulse oximetry is 97% on RA or room air. Okay, so what are we going to look at now? The instructions. All right, so we've got a lot of information going there on the left where we can toggle back and forth between the nurse's notes and the vital signs. But we're here now paying attention to what's happening here on the right side of the NGN or Next Gen NCLEX case scenario screen. Okay, so click to highlight the findings that require immediate follow-up. Select all that apply. So essentially, we have a select all that apply question here, and we're being asked to highlight. So we have some tokenized areas here that are you're able to highlight. All right, and you're going to make some decisions. All right, so I'm going to give you a moment to look at the assessment findings and ask yourself which among these are the most significant. All right, which ones require immediate follow-up here in this outpatient laparoscopy clinic? All right, I'll give you a second. And you can also pause here if you need a little bit longer. All right, and we're going to move on to reveal the correct answers. Correct response, ready? All right, if you selected last voided pre-op at 9 a.m., that would be correct. All right, if you selected received 1,800 milliliters of IV fluids intra and post-op. Okay, what about reports lower abdominal pressure and bladder feels full? Absolutely. If you selected that, then you are also correct. All right, and then abdomen distended, suprapubic fullness noted. All right, those are the correct responses in this particular question. All the others would be incorrect. All right, in the interest of time, we're going to keep on moving through the various screens in this 6-part case scenario. But of course, you can check out my Stand store for more, and that link is in, or that information is in the pinned comments. If you're interested in learning more about strategy and to cover those topical areas, and we're going to have a little bit of review right at the end. All right, so here we are now looking at screen 2, case study screen 2 of 6. All right, what new information do we have here to see? Well, the nurse's note. Now, at each screen, I would suggest that you take another look at the information that you have available to you. Usually, there's a bit more than you need, but there's also essential information embedded there. So, we're taking another look at the nurse's note. All right, before we take a look at the question itself here. All right, so here to the right-hand side of the screen, and I've made it a little larger than what you would see typically on the NCLEX because these are drop-down cloze questions, CLOZE, and these are the type of questions where you're going to get a little drop down option and you'll select from those options. Now here for the sake of this demonstration, we're just going to kind of highlight those. Okay. So let's put some focus on just one of them so that we can kind of zoom into the first question. All right, complete the following sentence by choosing from the list of options. All right, and what's the sentence? The client is most likely experiencing. All right, so we've kind of assessed this client. You got your nurse's notes over there to check out. All right. And you can also go back to see the vital signs. All right. And our choices are paralytic ileus, surgical site pain, post-operative urinary retention, or fluid overload. All right, which of those four options are you thinking that this client is most likely experiencing? All right, and we're going to go for the correct response now. It's post-operative urinary retention. Did you select that? All right, well, then you are correct. All right, and if you didn't, then let's think about why you would have made another choice. All right. Sounds like you may need a little bit more review in the area of this topic area. All right. Post-operative urinary retention. All right. As evidenced by which of the two choices would you go for here? Inability to void, suprapubic fullness, and large IV fluid volume. Or would you go for incisional pain and nausea? All right, so the question is asking you which of the two here provide the evidence for you to know that this is in fact post-operative urinary retention. I'll encourage you to pause if you need to. We'll move on with the correct choice, which is inability to void suprapubic fullness and large IV fluid volume. All right, suprapubic meaning above the pubic bone there. And generally, that's an area where we might note fullness, all right, or the patient may complain. All right, now we're moving forward to the last set of manifestations that you might see as evidenced by, all right, and would it be voiding difficulty after anesthesia or fever and cloudy urine? All right, we're looking at indicators here of problems that may or may not be associated with postoperative urinary retention. All right, you've already determined in the earlier question what you're working with here, or in the earlier response to this question number 2, what you're working with here, post-operative urinary retention, then you should see that this would be the evidence for you to support that. All right. And that evidence is presented here over in the nurse's notes. All right. Did you go with voiding difficulty after anesthesia or fever and cloudy urine? All right. The correct choice is voiding difficulty after anesthesia. All right. You see where we're going here with this particular case study. All right. We're still moving on. We're still moving on through, but that's just a quick review of the 3 choices you had and the correct answers to those choices. All right. Moving on to now screen 3 of 6. All right. So the information stays relatively the same. It absolutely is the same. We haven't taken a look at laboratory results or medication, and we won't. The 2 tabs that we're focusing on for the remaining screens will be basically what you see here in the nurse's note and in the vital signs tab. All right, and that tab's in the EMR, all right, the electronic medical record. All right, so what we can see now will be the question type, all right? So we're looking at a matrix multiple choice grid, all right, or a multiple choice matrix. So there's a single selection at least in each row, all right? If you do, whenever you see these circular dials or the radial dials, you can only really make that singular choice among the options that you have, all right? If you try to make another choice in that same row, that single choice will be highlighted. All right, so you have a choice here, high priority, monitor, or unrelated. You can see that there. But let's read the instructions as they look on the NCLEX. For each clinical finding, click to specify if the finding indicates that the client's status is a high priority, requires monitoring, or is unrelated. Note, each row must have one response option selected. Okay, so let us begin. Well, let's just take a look at the choices first. All right, and then we'll go and make the correct selections. All right, so bladder fullness with no void since surgery. Would that be a high priority clinical finding? Something you want to just monitor? Or is this just unrelated to the situation at hand or the scenario at hand? All right, so the second choice, IV fluids, 1,800 milliliters without output. All right, so that much in, zero out. Is this a high priority issue? Something we want to monitor, or is this unrelated, unimportant? All right, here's the next one, surgical site pain, 3 out of 10. High priority, monitor, or unrelated. Next one, ambulated or walked once since surgery. All right, so have we ambulated once since the surgery? Um, yes, it looks like we've only ambulated once since the surgery. Is this a high priority issue? Something we want to monitor? Or is this unrelated to the scenario at hand? And then finally, a blood pressure of 124 over 78 and an SpO2 or pulse oximetry of 97%. Is that a high priority? Something to monitor? Or is it unrelated? All right, you're asking yourself those questions as we move forward to our correct response slide. All right, did you take another look over at the vital signs, see if those looked okay? All right. Well, for bladder fullness with no void since surgery, that's a high priority issue. All right, high priority issue. If you chose that, you are correct. IV fluids, 1,800 milliliters without output. High priority issue? Yes, it is. Absolutely. All right. Or it certainly may explain some of the assessment findings that you are seeing. Okay. Surgical site pain of 3 out of 10. Is that a high priority, an issue you want to monitor, or is that unrelated? That is an issue we want to monitor. All right. We want to see if that number remains at 3, goes down, or whether that goes up to 4 or greater, where we absolutely want to keep an eye on that. Okay. All right. The next one, ambulated once since surgery. Is this a high priority issue? Yes, it is. Okay. And then finally, blood pressure, 124 over 78, and an SpO2 of 97% on room air. Is this something that we are going to consider a high priority issue? Or do we need to monitor that? No, not necessarily. That blood pressure looks fine. It's fine, and this patient being on 97% room air is fine for now. Okay. All right, so let's move on to case study screen 4 of 6. Case study screen 4, you'll see here, has brought us a new question type, right? But no new information here in the nurse's notes. No new vital signs information. All that still remains the same. All right. But we always want to check our tabs. I just want you to get into the habit of always checking your tabs when you move forward to a new case study screen. Okay. All right. So here on screen 4, we're looking at this question. Which 3 actions would be appropriate for the nurse to take? All right. This is called a select in question, meaning that, like a select all that apply, you're going to want to make all of the appropriate choices that apply, right? But here they're telling you exactly how many choices do apply. All right, so here it's 3. All right, and you can see by the square boxes that you can select multiple responses. All right, so take a look at those responses and see which 3 actions would be most appropriate for the nurse to take. We are on screen 4. That is the T screen, all right, in the RAP GTE formula. And the T stands for take action. All right, so what action are you going to take as the nurse? So this is a nursing intervention. And which of the 3 actions would be appropriate here? So are you going to perform bedside bladder scan? Does that make sense at this point? All right. B, or the second choice, notify provider and provide and prepare for a straight catheterization if needed. All right. Are you going to, the third choice there is encourage upright position and privacy for toileting. All right. The fourth choice there is administer diuretic per standing order. Are you going to do that? All right. And then the fifth choice is restrict fluids until further evaluation. Are you going to do that? All right. Those are your choices. Now, give your a moment if you still need another, but I am going to go ahead. So pause your screen if you need to. All right. Otherwise, we're going to move on and see what our correct responses are. All right. First one, perform bedside bladder scan. Absolutely. Makes sense here. All right. Second choice, notify provider and prepare for straight catheterization if needed. All right. There's your second choice. Yes. And then your third one is encourage upright position and privacy for toileting. All right. Did you make that choice? All right. Those three choices. All right. Well, if you did, very good. All right. So we're moving on now to screen 5. All right. Case study screen 5. So we always want to take another quick look at whatever tabs we have. All right. So nurse's notes, it's the same there. And then we're going to look at our new question. All right, this is another one of those click to highlight questions called highlight text. And if you get a question like this, again, we have those tokenized areas there that you can select by clicking your mouse. And that's going to create a highlight over the areas that you want to select. And in this case, the question is click to highlight the 3 most appropriate nursing interventions. Click to highlight the 3 most appropriate nursing interventions. All right, so it kind of works like a select in where you have 3 choices, right? Out of the 5, you have 3 responses that you're going to make. All right, I have you looking at those right now. I'm going to read them aloud. Nursing action. The first one is perform bladder scan and assess for retention. The second one is promote privacy and running water technique. All right, the third one is notify the provider if unable to void. The fourth one is apply warm compress to the surgical site. And number 6, push PO fluids to stimulate diuresis. All right, so I'm assuming that as we go through these questions, you have a sense of what these medical terminology mean. All right, to stimulate diuresis. All right. Put down in the comments for me what you think that means. All right. That having a full command of your medical terminology will certainly play a big role in how well you're able to do on the NCLEX. All right. So diuresis, can you read and understand what that word is all about? All right. If so, share with the group. All right, as we continue to move through this question. All right, so you have seen the choices. Which 3 did you pick? It's time to go for the correct responses. Did you pick perform bladder scan and assess for retention? That was one of our choices before that we had here. So you're kind of getting a sense of what these questions are about. All right, in screen 5, we're taking action. Yeah, T stands for take action. All right. B, promote privacy and running water technique. All right. What's the running water technique? Where you put the fingertips of your patient into maybe an emesis basin or a clean one or another basin with warm water in it and give them a chance to experience the warm water on their fingertips, thus possibly encouraging the sensation to uh, release their bladder and actually urinate. Okay. Privacy may also help. And then we might want to notify the provider if this patient continues to be unable to void. All right. That might be necessary here. All right, but do we want to apply a warm compress to the surgical site? No, not without another reasonable reason. And do we want to push PO fluids to stimulate diureses? No, that does not follow logic at this point. All right. Now, let's move over to case study screen 6 of 6. Right, we're trying to move through this question so that you can see how they're set up and how you might respond to a question, a 6-part NGN case scenario question, an unfolding case scenario question, such as we have here. All right, so at screen 6 of 6, we're going to take another look at the nurse's notes. All right, vital signs, laboratory results. We always want to check and see if a new tab has opened. And now we're going to take a look at the new or the last question type. All right, this is another one of those matrix multiple choice question grids. All right, a multiple choice matrix or matrix multiple choice. That's this question type, all right? So for each finding, click to specify the finding if the finding indicates that the client's status has improved, worsened, or remains unchanged. All right. Each row must have one response option selected. Must have one. All right. So you can't have two as you might in another type of grid. All right. Let's look at the choices. So voided 650 milliliters after catheterization. Is that an improvement? Is that a worsening of the patient situation, or is it relatively unchanged? All right. What about reports relief of bladder pressure? All right. That's a clinical finding that we have here. Is that an improvement? Is it worsening, or have things remained unchanged? All right, next one, abdomen soft and non-distended. And the last one is discharge, still delayed, meaning the patient's discharge from this clinic is still delayed. All right, so how are you going to judge this? All right, take another look at it. And now let's look at the correct response screen. All right, see what the correct choices might look like. All right, so if you went with improvement for the voiding 650 mils after catheterization, yes, that is an improvement, right? To go from 0 to 650, excellent, right? Especially after taking in 1,800 milliliters with that IV infusion that happened during and after the surgery. All right, reports relief of bladder pressure improved. That's good. All right, next one, abdomen soft and non-distended. Improvement, yes. And then discharge still delayed. Well, that remains unchanged. All right. So no worsening. Now, with that said, there might be a question that you would get where the sixth screen has some worsening, and that's not a reflection on you as the nurse or the test taker in this case. So don't ever worry if the condition of the patient or the evidence shows that the patient is worsening. It looks like this patient is improving. All right, based on the information, the new information here. Right. All right. So remember, when we're dealing with post-operative urinary retention or even with urinary hesitancy, there's a few things we want to remember. All right. It usually occurs immediately to 3 days post-op. That's usually definitely how it manifests in the perioperative environment. All right. It's always caused by some obstruction of the urethra. All right. And puts the patient at risk for hydronephrosis. Now, the acute and chronic causes are generally edema. All right. BPH. Do we know what that is? All right. Throw that down in the comments. If you don't know, check out those comments to see what your peers know about this, okay, and how that might cause an obstruction of the urethra. All right. Tumor, that could cause a physical obstruction. Inflammation, all right, being following surgery or being post anesthesia. Stroke, is also a possibility. All right. Now, the manifestations of urinary retention may be presenting as your inability to void. All right. So zero output. Bladder distension. All right. As we saw in our patient here today. All right. Restlessness could be a way to that this shows up. Restlessness is particularly in your older patients or patients who tend to be nonverbal. All right. Increased blood pressure is another indication of urinary retention, particularly in patients who uh, uh, have some immobility or might possibly be para or quadriplegic. Okay. Interventions. What are we going to do as nurses when we have patients who meet these clinical manifestations with these particular causes behind them? Well, we're going to position a patient upright. That's going to be one of the first things we're going to try to do. Provide that patient privacy so that they can relax. All right. We might try the warm water technique. All right. A bladder scan may make sense for this patient. Get a sense of how much fluid is actually filling up the bladder. All right. Ensure adequate fluid intake. Offer the bedpan. All right. Do the I and O. What am I talking about with the I and the O? Go ahead and throw that in the comments for me if you know what that is, okay? All right, might be super simple for some of you guys, but there might be others who are going, I don't know what she's talking about there. So check out the comments so that we can get a conversation going about this question. All right, and then finally, you might administer a medication called, I'm not very good at pronouncing this one, botanical chloride. Okay. Botanical chloride. That's one of the medications. I like to usually share some type of medication or several types of medication that might be used in certain scenarios, but there aren't a whole lot here. It's a lot of nursing intervention that you might do to help your client with this one. All right, we don't have straight cath mentioned here because we do typically need a doctor's order or physician's order to have a straight cath, but we're going to always be monitoring our patient, of course, and if it's appropriate, then that is what we'll do. All right, so I thank you for your time and attention to this NGN practice question. If you would love to join my live Zoom sessions for more, then subscribe here, but also go over to the Stand Store and subscribe there because that's where I will be live going over my coaching package, my coaching content, which we go deep, we go deep, okay? There we do drills, we do active learning drills. And if you are ready to pass your NCLEX on the next try, check me out here at my Stand Store. Thanks for your time and